Good afternoon. Thank you for joining us. Premier John Horgan says we need to bear down and non-essential travel in BC is prohibited for the next 2 weeks. He's also calling on the Prime Minister to work on limiting travel across Canada. Do you support prohibiting travel in BC and beyond? And after 12:30, more encouraging news on COVID-19 vaccines. Does it give you hope? What would make you confident about a COVID vaccine? I'm Michelle Elliott. Welcome to BC Today.
When it comes to travel, non-essential travel is prohibited in British Columbia, and it will remain that way for the next 2 weeks at least.
That's Premier John Horgan speaking to reporters this morning. We're taking your reaction to that. Would that prohibition affect any of your future plans? Or had you already decided to stay put to try and stop the spread of COVID-19? Give us a call, 1-800-825-5950. In Metro Vancouver, 604-669-3733. On your cell phone, star or pound 690. You can send us a tweet at BC Today or an email, bctoday@cbc.ca. And I have two guests with me. CBC Provincial Affairs reporter Tanya Fletcher joins me now. Hi, Tanya.
Hi, Michelle.
And Dr. Raywat Deonandan, an epidemiologist and associate professor in the Department of Health Sciences at the University of Ottawa. And good afternoon to you.
Good afternoon.
Thank you so much for joining us. Tanya, I'll ask you first about what the Premier had to say this morning. He urged against non-essential travel within BC. What does that mean? Is there an outright ban coming?
Well, he urged it with words today, but we didn't see any formal official health orders, new health orders come down today. We could see something more specific tomorrow, he alluded to. But as for today, he emphasized that essential travel must still happen. You know, there still has to be movement of goods and services around the province, but he emphasized that non-essential travel for at least the next 2 weeks should not be happening within BC. He was asked, could there be an outright ban on regional travel? Say you can't go between the mainland and the island or the interior and the north. Here was his answer to that.
I'm not suggesting that we put in restrictions beyond saying the obvious, that if you don't need to travel, don't travel. This is not the time to go storm watching on the west coast of Vancouver Island. This is not the time to plan for a large gathering of friends over the Christmas holiday. We need to focus on getting through the winter, getting through this second wave, which has proven to be significantly challenging. Again, not just in British Columbia, but the evidence is very clear. This is a global challenge, and we are not immune to that.
So you heard him say there, suggest that he's not necessarily calling for additional specific detailed restrictions in the way of a ban, because that would be quite difficult to enforce if it's within the province. But he again alluded to we might be hearing more about that tomorrow. On this note, he was also asked about calls from some doctors to have anyone traveling to, say, Vancouver Island quarantine for 14 days, right? He said he did talk to Dr. Bonnie Henry about that this morning. He says health officials are looking at that as a possibility. He'll wait for them to proceed. But at this point, he said he doesn't believe a mandatory quarantine for, say, just people going to the island is the best way to go. He was also asked about travel between the island and the mainland. Should essential travelers taking the ferry be allowed to stay in their vehicles? Because that's something that had come up earlier in the pandemic, right, with Transport Canada. So Horgan says he fully agrees that Transport Canada was premature in taking away that exemption for months in the summer, right? They allowed people to stay in their cars. So why would that exemption not be allowed during the second wave? He says that's a mystery to me. He's going to address it with the Prime Minister because that is technically federal jurisdiction, and discuss, allowing BC ferries to come up with maybe workaround strategies to make sure passengers are safe.
And on federal jurisdiction, the Premier, in his opening remarks, also talked about travel across Canada and lobbying the Prime Minister. What is he proposing? Yeah,
so he said he is going to reach out to Justin Trudeau on this. It did a little bit come out of left field. We weren't expecting him to say this, but he did say we need a pan-Canadian approach to travel, because people living in Coquitlam, they need to make sure they're living under the same rules as people in Chicoutimi, was the example the Premier gave. So here's John Horgan talking more about that.
We need a pan-Canadian approach to travel. We need to make sure that people in Coquitlam are living under the same rules as people in Chicoutimi. We need to make sure that those who want to come to British Columbia must only do so if it is essential for their business or their well-being. Beyond that, we need to stay in our tight social circles.
Yeah, so he did say that is something that he'll be reaching out to the federal government on. But again, when it comes down to enforcement and what kind of mechanisms would be used to do that, that's another question.
Dr. Deonandan, I know you look at numbers across the country. From your post there at the University of Ottawa, concerning rise here in BC, 717 new cases yesterday. When looking at these rising numbers, what do you think? Does it make sense to limit travel?
Yeah, it always makes sense to limit travel. It's one of the lesser resource-intensive methods of mitigating transmission. And when we look around the world at the places that have done this well, places like East Asia, Australia, New Zealand, and elsewhere, some things leap out. Among them is, number one, they acted early and hard. Number two, they got really good at finding cases. Number three, they monitored their borders and limited travel very, very well. So it strikes me as you don't want to be moving infection around unnecessarily if you don't have to. And having the principles of containment be uniformly applied across the province and the nation seems simply like good infection control.
How much of an impact would limiting travel make when we keep hearing the biggest source of transmission is private gatherings?
Well, people often travel to attend parties, right? Mm. Also, how do those private gatherings become super spreading events? Someone shows up to spark that seed, deliver the spark on the pile of dry tinder. And sometimes that person is a traveler. It's not a perfect solution. It's one of the many layers of mitigation strategies that we include, especially if you're in a situation where you have a low incidence rate in your community. You do want to prevent reinfection from outside. So neighborhoods with low transmission should look to preventing reinfection.
Let's take some listener reaction now. We're asking for your thoughts on this. The Premier says, stay put. Non-essential travel in BC is prohibited for the next 2 weeks at least. He's also calling on the Prime Minister to work with provinces on limiting travel across Canada. We're taking your reaction. What do you think of that? Does it affect you, or had you already decided to stay home? Give us a call, 1-800-825-5950 in Metro Vancouver, 604-669-3733, and on your cell phone, star or pound 690. We have a tweet from Serge. How is non-essential travel in BC and interprovincial travel going to be enforced? I see far too many people traveling with abandon between Alberta, Manitoba, and British Columbia. Nobody seems to realize the gravity of the situation. Thanks for that. At BC Today is where you can send us your thoughts. And Dorothy is our first caller now from Cumberland. Hi, Dorothy. What do you think of this idea?
I think it's a good idea, but an even better idea would be to pass a law for people to wear masks in a public place. Many people have been asking for a mandate for mask wearing in public places, but the government hasn't done anything about it except encourage people to wear masks. Some people will not wear a mask unless there's a law saying that they have to wear a mask when they go out to public places. A mask would definitely help to bring the COVID numbers down, and I think the government should pass a mandate.
Okay, so that's what you would like to focus on. Dorothy, thank you for the call. I'm going to go to Dr. Deonandan on that. You know, on masks, there's a recommendation from the provincial health officer to wear masks in indoor public spaces. There have been calls from business groups specifically asking for mandatory masks. There are, however, plans that they have to submit to WorkSafe BC that include things like having masks in place. The Premier this morning said, they don't want to be heavy-handed with restrictions, and I'm wondering what your thoughts are on that, the tension between recommendations and orders.
Right. First of all, the data is pretty clear from where I sit that mask wearing does serve to mitigate transmission when enough people do it. So the question now becomes, do you strictly recommend or do you make it compulsory? And that depends on the nature of your population and what they're willing to go with, how much of an authoritarian streak or anti-authoritarian streak they have. However, I will say that if you make it mandatory, you take the onus off of the individual business owner to be enforcing these recommendations. And you, in many ways, you make the government the bad guy, as they should be, right? And you create a greater sense of community in some ways. I'm in favor of the mandatory mask law. I think it's actually better to encourage conformity of usage across the province. And I think ultimately that's where you're going to end up if you really want to have a strong mitigation strategy.
Let's take another call now. Justin is on the line from Lillooet. What do you think of a prohibition on traveling?
Well, I think it's a great thing. I think it needs to happen, and we have seen an uptick in tourism in our small town this summer, just because people are getting in their cars and getting out of the Lower Mainland and coming out to places like Lillooet and even north of us quite a bit too. I've heard the same thing. But I think that a big part of the problem is that the tourism bodies, governing bodies in British Columbia, are also advertising quite heavily. Like I've noticed Tourism Whistler, Tourism Vancouver Island, Tourism British Columbia. On all of my social media outlets, I see nothing but advertisements telling me to get in my car and go drive around the province. And I don't really agree with that. I think that, it's counterproductive, and I also think that, you've got one hand of the government telling people to stay home, and then you've got the other hand of it, funded by the government telling people to get their families in the car and go travel around the province. And
how do you square the two? Justin, it's a good question. Thank you very much. Tanya, we have heard so much about how the tourism industry has been hit so hard by pandemic restrictions. How do we square that? All the marketing, promoting local tourism, and now this prohibition on non-essential travel.
And that is where the tension comes into play, right, Michelle? I mean, we heard Premier John Horgan, I think it was in late June when we moved to our next phase of reopening. He stood up and announced how, Travel Around BC Destination was going on a marketing campaign, a big blitz promoting travel. So now to try to put that genie back in the bottle is going to be tough, and it will be especially difficult for those who rely on tourism. And, we've got a reporter out in the newsroom as we speak chasing that very angle. How is this going to impact tourism? Because many businesses that rely on it, and keep in mind, tourism and travel makes up a huge portion of BC's economy. How many of them were hanging on by a thread already. And then just when they were able to kind of restart barely in time for the summer season, they were banking on the winter season, a lot of ski resorts especially, but even, holiday travel for Christmas, even, just if your family wanted to maybe head to Bowen Island or up to Sunshine Coast or to Whistler for a couple days over the holidays. If that's not allowed now, then what will that mean for those businesses? And I think the first tweet you read out from one of the listeners hit on something as well about enforcement, right? What is the mechanism in place to do that? John Horgan was asked about that, specifically with out of province travelers, if he's, alluding to the fact that there needs to be some federal restrictions there. I mean, would that onus be on the airlines to ask people ahead of time before they board a plane? Are you going to the province, across the country for essential travel only? It would be much more difficult to enforce driving, right? Driving across the BC-Alberta border, for example. And John Horgan pointed that out today. A lot of people live in BC and work in Alberta or vice versa, and there has been transmission between provinces. So I think that's one of the things that will have to be looked at. But Horgan also pointed out to the Maritimes how they brought in that bubble, and that proved successful for them. But the tricky part is that we have free mobility within Canada, right? It's part of our citizenship. And so Horgan acknowledged we need to make sure we have an approach to travel that's not inconsistent with our rights as Canadians and with that citizenship. And so he says it's more of a question of leadership, is asking the Prime Minister to join the provincial leaders in speaking with one voice in telling people to stay home, basically, until there's a vaccine rolled out. So he said we'll work on enforcement mechanisms and how they could potentially use 14-day quarantines going forward. He acknowledged that as a possibility of out-of-province travelers do come to BC, could they be forced to self-isolate for 14 days like we see with the American travel? He said that's on the table, basically. But that's something that would need to be discussed federally.
We're getting questions, lots of questions already on how this would work. A couple on the tourism aspect of it. Terry is asking, how is the ski industry going to do? Allison is asking about Whistler and people traveling here from the Lower Mainland. That is non-essential travel, Allison writes. Lots of questions coming in as well about what counts as non-essential travel. Sharon is asking, I would be interested to know what travel is defined as. Would a trip between Surrey and Vancouver, for instance, be part of this? Thank you for that. I don't know if that's something that you got into in terms of those kinds of details from the Premier this morning. Yeah, no, and I expect we'll hear more about that tomorrow. Again, John Horgan alluded to the fact that with the Provincial Health Officer, Dr. Bonnie Henry, and Health Minister Adrian Dix, their regular Thursday update tomorrow, he did suggest he said something about more orders. So some of them could be maybe in writing to do with travel restrictions in how this would work. But yeah, those are very valid questions. I had an email as well myself saying, I'm wondering about travel specifically from Fraser Health to Vancouver Coastal Health for those looking to ski. Example, people, if they want to drive from Abbotsford to ski at the local mountains at Cypress or Seymour or even Whistler, should that be allowed? And so it hits on a lot of jurisdictional questions, I suppose, and that overlays with November 7th. It's been 11 days since the province announced the targeted restrictions just geographically, right, with Vancouver Coastal and Fraser Health. So, I mean, technically, can we go to, if I live in Vancouver Coastal, so if Cypress and Seymour are in Vancouver Coastal, can I still go, drive across the Lionsgate Bridge and go skiing on the North Shore for a day? Those are questions we don't know. Is that considered non-essential travel? Is it even considered travel if you're within your own health region? So those are questions we simply don't know at this point. Okay, I'm sure they will be asked. Heather is joining us from Coquitlam. What do you think of restricting travel, Heather?
I believe it is essential at this time. I think we need to go back to basics here in the spring. The vast majority did comply. And we did fairly well. I don't think it's, I think it's that simple. And take pandemic responsibility. I'm unable right now to travel when it should be absolutely necessary to be there for a friend who's lost a huge person in her life. And I too need her. I live alone. I live with a trifecta of autoimmune diseases. It's very hard to isolate, and especially when you know someone, you want to be with someone to distract them, to be there, to support them, and you just can't get to the island to do it. But that is the harsh reality, and we need to do this so that we're protecting not only ourselves but others. So, I mean, I really think we need to go back to basics. We all, the vast majority, complied in the spring. It's that simple. So whether, the government pushes restrictions or not, we know what to do. That term pandemic responsibility that you just said. Heather, thank you very much for the call. Good to hear from you. Thank you. That's Heather in Coquitlam. Let's head to the Sunshine Coast now. And Jim is joining us. Hi, Jim.
Hi, how are you doing?
I'm okay. Thanks for calling. What do you think of prohibiting travel in BC?
Well, my question
non-essential travel.
Premier, my question for the Premier and the Minister is that what about families and even individuals that have already booked a week or two ski holiday at Whistler or Big White or one of these interior resorts and have paid money and can't get a refund? Are they expected to just abandon those reservations? And if they don't and go ahead, are they going to be punished or fined by the government? I mean, how is this going to be enforced? Yeah, is that something, had you made those bookings? No, personally I haven't, but I'm just thinking about many people that have. And a more general question is, what about the actual ski resorts themselves, Whistler, Big White, Silver Star? Are they, if they can't have people coming in to use their facilities, then they pretty well should close for the season, I would think.
Jim, you're touching on some questions that we've been hearing so far as well in terms of the ski resorts, but you're raising some good questions about people who have booked those holidays and what should they be doing. Thank you very much for calling.
And one last point, there's no difference really between storm watching in Tofino and skiing at Whistler or Big White.
Okay, you're referring to the quote from John Horgan this morning on storm watching in Tofino shouldn't be done.
Exactly, yeah.
Okay. Nice to hear from you, Jim. Thank you.
Sure.
Next up is Mary Lamb from Notch Hill. Hi, Mary Lamb.
Hi there, Michelle. It's Marilyn.
Pardon me, Marilyn.
And, the travel ban, it's so necessary. I don't like it either. I'm lonely. I miss my mom. I miss my brand new nephew. Hendrix was just born. I want to go see the kids. I want the kids to come here. We all know it's the right thing to do. Stay at home. Keep the virus. Let's get it under control. We were doing so well in the spring.
Marilyn, thank you very much. Thanks for that point. That's Marilyn joining us from Notch Hill. Tanya, she's getting there to, I think, a point and a comment that I've heard quite a bit, and we've heard from the provincial health officer as well. We need to get back to how things were and that the vibe, as she said, from springtime. What do you make of her comment there?
I think she's right, but I think the key difference is that in the spring we were heading into the summer months where we could be outside safely, right? We could be doing outdoor activities, and Dr. Bonnie Henry has also stressed that is important for our physical and mental health. And I think skiing, right? She has said in the past, even finding outdoor activities that we can do as we head into these colder winter months, indoor group fitness classes are a no-go. She's made that clear. So I think there will need to be considerations made to, we are in a very different time of year going into this second wave. And so how do we balance those things? And going back to the ski hills and the ski resorts, right? They have relied heavily, traditionally, on international visitors coming to Whistler. And that's a large part of the economy. They've had to shift their marketing strategy and try to target locals, right? To spend their tourism dollars on the local ski hills. And if that can't happen, that is a huge economic impact. And I think that is what the province will be trying to juggle. It's a delicate balance of how do we stay safe and, yes, restrict travel, but still allow outdoor activities that are as safe as possible when in a pandemic. And yet keep those businesses alive as much as possible. Those are all questions, and Jim brought up some questions that I myself would love to put to the Premier if I had 10 follow-ups. And I'm sure those will come in the coming days. But
you get one, and that's if you don't have any technical difficulties. Here's an email to close from Catherine, who writes, I'm really nervous about the BC inter-travel bans, but I support them. I live in the interior and visit my sister in Vancouver at Christmas. We don't have other families, so we are worried about not being able to see each other and being alone for the holidays. I am immunocompromised, so we try to be very careful about safety precautions and health advisories, and wish others would too, to get a handle on this. We would like 2020 to end on a happy ending for everyone. Catherine, thank you very much for that. And Dr. Deonandan, you will be with us in the next half hour, but just a comment from you to close on that. People feeling perhaps that fatigue, but also the need to, as our last emailer just said, to have a happy ending to 2020.
We've done well, all things considered. I mean, the way we've handled this epidemic has been filled with people sacrificing for the betterment of other people, which to me is the signature of being a Canadian. We're not the Americans. We have not reveled in selfishness. We've reveled in community and sacrifice for community, and that's a good thing.
All right. Thank you very much, Tanya Fletcher, for your time. Off you go to ask more questions.
Thanks so much, Michelle.
That's CBC Provincial Affairs reporter Tanya Fletcher. And yes, Dr. Raywat Deonandan, epidemiologist and associate professor in the Department of Health Sciences at the University of Ottawa. He will be back with us in our next half hour as we discuss a glimmer of light at the end of what seems like a very long tunnel. Some big and encouraging news on the vaccine front this week. Does it give you hope? And what would make you confident about a COVID vaccine? We will get into that discussion coming right up after this CBC News Update and Robert Zimmerman. Rob, thank you very much. That is Robert Zimmerman with your CBC News Update. Welcome back. You're with BC Today here on CBC Radio 1. I'm Michelle Elliott. Thank you so much for joining us. If you're tuning in from Campbell River, you're getting us at 104.5 FM, in Enderby at 92.7 FM. And online, you can listen live, cbc.ca/BC, or on your CBC Listen app. 12:32 now, 1:32 in the Mountain Time Zone. Well, looking ahead to the future and the possibility of a COVID-19 vaccine. Pharmaceutical companies Pfizer and Moderna have announced successful trials of their vaccines, and Canada's Deputy Chief Public Health Officer says most Canadians could be vaccinated against COVID-19 by the end of next year. But the federal and provincial governments warn that until vaccines arrive, Canadians will need to follow public health guidelines. And though the news is promising so far, questions remain around those clinical trials. Well, we'd like to hear from you. Does this news give you hope? What would it take for you to have confidence in taking the COVID-19 vaccine? Give us a call, 1-800-825-5950 in Metro Vancouver, 604-669-3733, and on your cell phone, star or pound 690. You can send us a tweet at BC Today or an email, bctoday@cbc.ca. And epidemiologist Dr. Raywat Deonandan is back with us again for this conversation. Hello again.
Hello.
And I'd like to bring in another voice now. Julie Bettinger is an associate professor in pediatrics at the Vaccine Evaluation Center at BC Children's Hospital. And good afternoon to you. Hi there, Julie.
Hi.
Hi, thanks so much for joining us. I'll start with you, Julie. Welcome to the program. How significant are these developments in your view?
Well, I think it's a bit hard to know. We don't usually judge science based on press release. So, none of the details about the studies have been released. We don't have access to the data. So it's certainly hard to really know how to interpret it. I would say, assuming what's been released is correct, it's actually quite exciting. And certainly these vaccines are looking to be more promising than I think we were initially thinking they might be. So that's very encouraging.
And what about for you, Raywat? How excited should we be about this?
Oh, I agree with Dr. Bettinger. This is extraordinary. I mean, we're expecting an effectiveness of 50%. That would have been okay for COVID vaccine. The seasonal flu gives us between 40 and 70% effectiveness. To get 90% and above is fantastic. And to get this quickly is a triumph of our biosciences industry. Now it's up to our administrative infrastructure to see if we can deploy it. Well, assess it first of all, then deploy it at scale in a time frame that gives us herd immunity in a way that doesn't destroy our economy further. So I'm very excited. This is the bright light at the end of the tunnel, but the tunnel is long and dark.
Dr. Bettinger, the details, as we've mentioned, are thin beyond those press releases, but generally, what criteria would a successful vaccine have to meet?
Well, so I think, again, you'd want to have really high efficacy data. Efficacy is how well it works in sort of a perfect setting. And we're certainly seeing perhaps that with at least the first two vaccine candidates. I think probably more important is that you need it to be safe. If it's not safe, we're not going to use it. And so, again, that's where we're going to need to look at the data from these clinical trials and make an assessment of the safety. And then I think the third piece is it's got to be easy to use, and ideally you'd have a vaccine that you wouldn't even need a needle for. So, I don't think any of our existing candidates will fall into that category. But, if you're ranking what you want in a vaccine, those would be characteristics I would look for. Oh,
so it would be taken orally?
Or nasally. We have the flu mist vaccine for influenza that we're currently using that is a nasal vaccine.
Okay. And Dr. Deonandan, she touched on safety there. We actually have a tweet from Scott who's asking, can you ask your guests about potential side effects? Do we know enough about that?
Right. For these two vaccines, what we know so far, which is very little, is that no serious adverse events were reported, as far as I know. And a serious adverse event would be something like death or something requiring hospitalization or long-term disability. The common side effects are pain at the site of injection, fever, some fatigue lasting a day or so. I got my shingles vaccine a couple of years ago, and I was out of it for 2 days, which was, bad, but that's fine because now I'm immune to shingles. So that's not unexpected for vaccines. It may be more common than we get in the flu, but so far nothing serious has been reported.
Okay, we are taking comments from our listeners on this as well. If you have any questions, what do you think of the news you've been hearing on COVID-19 vaccines? Is it giving you hope? And what about your confidence? What would it take for you to have confidence in taking a COVID-19 vaccine? Our phone lines are open. 1-800-825-5950 toll free. In Metro Vancouver, 604-669-3733. And on your cell phone, star or pound 690. Let's head to Vernon. And Neil is calling us now on vaccines. Hi, Neil. What do you think?
I think it's an absolute necessity. And no quibbling. I think one of the best lines that has come out of the past 2 weeks on the public airwaves when the mayor of Philadelphia said to Donald Trump in kind of a rhetorical address, said, "Come on, Donald, it's time to put your big boy pants on." And I think it's time for everybody to put their big girl pants on and their big boy pants on and take responsibility for being a Canadian and being a British Columbia person. I'm 78. I dare not go even along the hall of my apartment building without a mask. And they're nice people, but I can't afford to take a risk. So thank you for hearing me.
Well, thank you very much for calling in, Neil. Grant is up next now in Victoria. Hi, Grant.
Oh, hi, Michelle. Yes, my concern is, first of all, there's a reason that past vaccines have waited 5 to 10 years before declaring them safe for use. And that's because of long-term side effects. I have no doubt that the short-term side effects are going to show up pretty quickly. That's why they're short-term. But the long-term effects, what's it going to do to the immune system in 5 years' time? To an older person, to a younger person, it's been documented that vaccines given to children when they're too young confuse the immune system because it's still developing. So, yes, I want to see what they're guaranteed. Well, I can't guarantee what's going to happen in 5 years' time, but I'd like an answer to that one.
Your concerns about long-term side effects. Grant, thank you very much. Who would like to tackle that question?
I guess I can go first. It's Dr. Deonandan here. First of all, he's absolutely right. We don't know what the long-term effects will be. We don't know what the long-term effects will be of COVID infection because we've been living with this disease for less than a year. So our options are we wait for a couple of years or we don't. And if we wait for a couple of years, we live like this until then, which I think is intolerable for a lot of people. Also keep in mind that the other alternative to not exposing ourselves to this vaccine is to expose ourselves to the virus. Vaccines simulate exposure to a virus. So you're kind of getting the same thing, right? The long-term effects of infection versus the long-term effects of the vaccine. That's the way I look at it. And maybe Dr. Bedinger has a different view.
Sure. I want to get to Dr. Bedinger in a moment. I just want to ask you as well a follow-up question to what Grant said there about vaccines given early to children, confusing the immune system. Can you elaborate on that a little bit?
Oh, well, first of all, this vaccine is not being tested on children. And it's true that children's immune systems are different, and that's why we're not testing it on children. So it's going to be some years before I think we start doing clinical trials on children for any vaccine candidates for COVID.
And Dr. Bedinger, this gets to the confidence question. You know, what would it take to make people feel confident, and despite perhaps those long-term concerns or not knowing what happens in the long term? How do you address that?
Well, actually, I want to clarify a couple of points. Vaccines don't confuse children's immune systems. They don't overwhelm children's immune systems. So that's a sort of a fallacy around vaccines, and I just like to correct that. I think also children will be enrolled into clinical trials. Probably, my estimate would be in 2021. So we will, first it'll be given probably in teenagers, and then we'll move down in terms of younger children, which is how we do with all of our vaccine candidates. So I'm hopeful that we may be able to start immunizing our children with a vaccine by next fall. It may not be till early 2022, but I think we're definitely on the road for that. Now, did you still want me to address the confidence question?
Yeah, sure. I'm really glad that you did address that question about children. Thank you very much for that. But yes, please go ahead in terms of the long term. Grant was talking about 5 years down the road, for example.
Right. And I think on that point, what we have that's different here that we haven't had with our other vaccines, part of the reasons it's taken 5 to 10 years is that often with our older vaccine platforms, we haven't been able to target as quickly the vaccine antigens that we need to put into the vaccine. And so we have a lot more newer technologies that were applied to the development of this vaccine that really shortened that lab cycle that goes on, that you're, testing it, in the lab before you even give it to humans. And so we really condensed that timeline down with this vaccine, which I think is one of the really exciting things as we move forward, because we're likely to encounter other pandemics, other new pathogens, and we've now got technology in place that it's not going to take us 10 years to get to a vaccine. We've shown we can do it in a year, which is pretty exciting.
Okay, and let's take some more questions now. Great to hear your questions. Give us a call, 1-800-825-5950. In Metro Vancouver, 604-669-3733. What do you want to know about where we are on COVID-19 vaccines? And does all the news you've been hearing this week, does it give you hope? Does it give you confidence? What would it take to make you feel confident about a vaccine? Andre is calling us now from North Vancouver. Hi, Andre.
Hi. It's funny because you just said that the vaccine isn't getting tested on children, but what are the children going to do, right?
How old are you, Andre?
I'm 13.
You're 13, okay. So you're concerned about the health of children, is that right?
Yeah, because, what if we don't have a vaccine and all the adults do?
Okay, and I'm going to get the experts to respond to you, but can you tell me a little bit more about, how closely you are watching news around COVID-19 and how this impacts you?
Well, I'm fairly concerned because all my activities have been canceled, and the last thing I want is school to get closed. So, yeah.
Mm-hmm. Okay, and so when you hear news about vaccines, what goes through your mind?
Well, it's great. 95% success rate. That's good. And then you just mentioned that it wasn't tested on kids. Oh, great. What are we going to do now?
Well, I'll get some clarity on that then. I think we got a little bit of clarification on that, but I'll get some more from our experts. But I'm really glad to hear from you. Nice to hear from a 13-year-old on this, Andre. Thanks so much for calling.
Thank you.
And Dr. Benninger, can you just perhaps address his concerns there about, access for kids?
Sure. No, definitely. So the vaccine will be tested in children, and it will be tested before it's just given to kids. We would never just give a vaccine to children if it hadn't been tested. So the first steps in a clinical trial are to test it in healthy adults. And in the case of the COVID vaccines, we did healthy adults as well as older adults, which is not usually done in clinical trials. So I've been excited to see the inclusion of older adults in the clinical trials. The next step will be to move it into adolescents, so probably 12 to 15-year-olds, 12 to 17-year-olds will be enrolled in the clinical trials just like the adults were. If the vaccine still is safe, if it still works, then it'll be tested in younger children.
Okay, thank you very much for that. Dr. Deonandan, did you want to add anything to that as well?
Sure. It's important to remember, of course, that while some kids do get sick from this and some unfortunately do die, they're extremely rare, and the vast majority of children will not even get sick if they get infected with this disease. That's one of the reasons we're not too concerned. Our concern about schools and things like that is that schools tend to be pandemic accelerators. Kids pass it on to their parents and grandparents. But another thing to consider is this thing called herd immunity, and that's when sufficient numbers of people get immune so that nobody else has to get the vaccine. So if all the adults around you are immune with the vaccine, the kids don't really need it because they'll never encounter the disease. That's the hope of herd immunity. But again, to be safe, we're going to start giving it to kids in a couple of years or so. So everyone will eventually get covered.
1-800-825-5950 is a toll-free line. Locally in the Lower Mainland, 604-669-3733. Let's head to Vancouver Island now, though, and Wes is calling us with a question. Hi there, Wes.
Hi, happy pandemic.
Okay, well, thank you for calling. What's your question?
Our government's already said that it's going to be distributed freely to everybody. I mean, there's obviously a cost. Do pharmaceutical companies, are they like the cartel where, they jack up the price like gas, whether we're using it or not, and hold us over a barrel? Is it going to be a per province thing? Is there any idea what this would cost?
What would it cost province to province? Wes, thank you. Who would like to take on that cost and distribution?
Well, I'll take a shot at it. My understanding is that the federal government purchases en masse from the vaccine manufacturers and then distributes to the provinces. And some vaccine manufacturers, like AstraZeneca, for example, have committed to giving it the scale cost, so the cost of production with no profit attached to it. So I don't know exactly what the price will be, but it's not being passed down to the taxpayer, is my understanding. So that's good news. There's also a movement internationally to make sure that poor countries get access to COVID vaccines. It's called the Kovacs Initiative, and that involves some wealthy donors like Bill Gates making sure that the cost is down to scale.
Dr. Bettinger, should there be concerns about the public being able to access this?
So that's a great question. I think we're probably too early in the process to know if people need to be concerned about that yet. I mean, I think certainly the goal is to have it accessible to everyone, but, sometimes what's accessible to some may not be accessible to others. So I'm sure that the public health planners are taking all of that into consideration right now.
Okay, I have a question for you, Dr. Bettinger, because this is a BC-specific question. Lindsay is actually asking us about flu vaccines, writing that the distribution has been very difficult for pharmacies in BC to predict and manage, as public health distribution is often unpredictable and supply is limited. How do you think we can better manage this with the COVID vaccine, and how do you think healthcare workers can start educating people now on the safety of vaccines? So a couple of questions in that.
So in terms of the BC distribution, I'm not really the right person to be answering that question. Okay. So I'm not going to tackle that one. In terms of the safety of vaccines, I do think it's really important that healthcare providers themselves understand our vaccine safety monitoring system, have an understanding of how vaccines are evaluated in clinical trials, and are then able to communicate that to their patients, because I expect a lot of their patients will have questions about the COVID vaccines.
Thank you very much for that question. And let's take another one now here from Port Alberni. Jillian is on the line. Hi, Jillian.
Hi, I'm happy to hear about the vaccines, but I am concerned that any rollout of the vaccines will be accompanied by a major spike in infections for a couple of reasons. Number one, I think there will be a tendency for people to think the vaccine is a magical fix-all, and they'll immediately resume high-risk behaviors. There are a lot of people who are understandably frustrated with the way things are going, and any presence of a vaccine is liable to be just an excuse to get back to things as they used to be. And I also think there's, again, magical thinking around the presence of a vaccine will magically make the virus vanish completely. And all of the medical professionals are saying that we will have to live with this virus like we live with influenza and colds. So that's my main concern. And I think a lot of the reason for that kind of thinking is just generally inadequate health education starting in the schools. Our bodies are the one vector we have to get from cradle to grave, and yet while we have to learn math and geography and language arts, the knowledge of our health is not required to graduate. So doctors and medical practitioners are fighting a losing battle.
Do you think that leads to attitudes then, the complacent attitudes?
Yeah. It explains a lot of the attitude and a lot of the lashback against safety measures that some of us don't understand. And it's simply because those people don't have the foundational knowledge they need to understand why they're being asked to do these things.
Okay. Jillian, thank you very much for the call. I want to put that comment to our guests here about, a vaccine as magically changing everything. To what extent will a vaccine actually change what we're doing now? Let's perhaps go to Julie Bettinger on that first.
Okay, sure. So yeah, I think it's going to be important to recognize that we're not immediately going to have enough doses for the entire Canadian population. So, I don't know how the doses are going to be rolled out. I don't know how many we're going to initially get, but I'm certain it's not going to be at a number that's sufficient to immunize everyone at once. So I do think people need to recognize that we will be living with this virus for a while. And, worst case scenario, for the rest of our lives, we won't get rid of it. That said, we do need to temper expectations around a vaccine. And I think at the very beginning, someone said a very long, dark tunnel. Yes, we're still in that dark tunnel, but the vaccine provides a small light at the end there. But it's not going to be immediate, and it's not going to be a silver bullet. Okay.
Dr. Deonandan, what does it change?
Yeah, so this desire for external salivation is hard-baked into the human psyche, isn't it? I mean, those of us who suffer from chronic illnesses, for example, would rather have a drug than to change our behaviors or our diets. But it's always in our power to quell transmission of this disease by simply diminishing the number of contacts we have on a day-to-day basis, but we'd rather have the vaccine do the work for us. We're going to have masks and distancing and limits on gatherings well into next fall, probably. And it'll take a couple of years to get back to full normality, especially since this is a global pandemic. We won't have full open international travel until it's squelched in India and Brazil and other hot zone areas. It's going to take a while. Given, though, that the vaccine has very high effectiveness, eradication is not entirely off the table. It's going to be hard. There are huge barriers in place. It's not like smallpox. It had some advantages for eradication. But we could start talking about that in a few years. Until then, though, I anticipate we're going to have a yearly COVID vaccine, much like we have the yearly flu vaccine.
Okay, actually, that is a question that Art is asking. How long after the second vaccine, 28 days after first inoculation, would a person be considered immune? I guess asking how long that immunity would take, and you're saying we may have to get the vaccine yearly.
We might have to. We just don't know yet.
Okay. All right. Arthur, thank you for that question. Jennifer is calling us from Nanaimo. Hi, Jennifer.
Hi.
Hi.
Hi there. My question was about the vaccine, if it was going to be made mandatory, especially for healthcare workers, because I heard that may be a possibility. But the question I have around that is, I work for Island Health, and every year we're told if you don't get the flu shot that you have to wear a mask. So my question is, if masks are actually working, then should we have the option to wear a mask, or is it going to be made mandatory for healthcare workers to get the shot?
To get the shot. Okay, so your question is, will it be mandatory for healthcare workers? And do we know at this point?
This is Julie. I'll jump in. I don't think we know, and I've not heard any conversations along those lines at this point. I think we're all just hoping we get a vaccine that works, to be quite honest. And I think it would be really far down the road before anyone would start talking about mandatory vaccination.
Okay, it's a point that our earlier caller mentioned as well, making a vaccine mandatory. What are your thoughts on that, Dr. Deonandan?
I'd be surprised if this were made mandatory, simply because we haven't got the safety data for a number of years to be confident in doing so. It's possible, though, that for those positions that require vaccinations, you could instead institute mandatory frequent testing and mask wearing to make sure you're not infectious. And that wouldn't be a lot of people, so we have the capacity to do that.
I have just a couple of minutes here left in the program. I want to make sure that we get final comments from both of you. Just what is the message you would like to send to the public right now as they hear this news about vaccines and efficacy? What do you want them to keep in mind? Julie Bettinger.
So I think cautious optimism, and to please continue wearing your mask and social distancing. That's the only thing we have right now that will stop this infection. And as we look at how rates are increasing across the country, it's the most important thing that all of us can do.
Okay. And what about you, Raywat Deonandan?
Some sense of normality is within sight, so celebrate that. In the meantime, we have to stay put. Again, the tunnel is long and dark. Don't jump out of the car and run to the end. Stay in your car and wait it out with perseverance and circumspection. So be responsible until the vaccine arrives.
Thank you so much to both of you for lending us your expertise. Really appreciate it.
Thank you very much.
Sure.
That's Dr. Raywat Deonandan, an epidemiologist and associate professor in the Health Sciences Department at the University of Ottawa. Dr. Julie Bettinger is an associate professor in pediatrics at the Vaccine Evaluation Centre, and that is at the BC Children's Hospital. That's it for our program today. My thanks to everyone who joined us on the show. Great to hear all of your questions and your comments today on the open line. You can send us more of your thoughts to our email. That's bctoday@cbc.ca. And tomorrow on the program, Angela Sterritt will be in the host chair, and she will take your questions on how to get your kids through this time right now. Sports may be canceled. They're not able to hang out with their friends as much outside of school. What do you do to encourage your kids through this time? How are you having those conversations? Her guest will be Dr. Shimi Kang, a child psychiatrist. That's tomorrow here on BC Today with guest host Angela Sterritt. I'm Michelle Elliott. Thank you so much for listening to BC Today. I hope you have a great afternoon. Stay tuned for the news coming up to 1 o'clock. Take care. Have a good afternoon. We'll talk again tomorrow.